Healthy Living in the Four Corners is brought to you by Southwest Eye Consultants, specialized medical and surgical eye care. Do your eyes sting, burn, and feel scratchy? Does it feel like you have something in your eye that you can't wash out? Or do you have difficulty wearing contact lenses? You may be suffering from dry eye syndrome. At its most basic, dry eye results from your eye's failure to produce tears. Tears have three components: the watery fluid produced by the lacrimal gland, and mucus and oils produced by glands underneath the eyelid. Together, they work to coat and protect the surface of the eye.
Tears are very important for protecting the eye from infections because it's constantly wiping away or washing away bacteria from the surface of the eye. As we know, our bodies, our skin, our mouths, the surface of our eye are covered with our normal flora, which are good, healthy bacteria which help us live. And the good bacteria help prevent infection from pathogenic or disease-causing bacteria. So the tears actually have antibacterial properties in them. So it's not just the windshield wiper washing away effect, but they also have chemicals and molecules in them that help prevent bacterial infection.
Treatment for dry eye varies depending on the causes. Your eyelids may not close properly, in which case surgery may be required to insert weights in the eyelid or tighten skin. Dry eye could be caused by environmental conditions or a malfunction of the glands that produce the tear fluids. In that case, Dr. Gebhardt recommends over-the-counter application of artificial tears.
The important thing to distinguish is that if you suffer from dry eye, you want to make sure you're using something that is only an artificial tear. A lot of the eye drops available over the counter also have a redness reliever component, which if used frequently will actually exacerbate dry eye. So you want to make sure you're using something that is only an artificial tear, and if you have an artificial tear that has preservatives, you only want to use it for 4 times a day. So there's 2 different types of artificial tears. There's ones with preservatives and there's ones without preservatives. And if you're needing a lot of artificial tears, you would want to use the preservative-free variety.
If you find that you need artificial tears more than 4 times a day, check with your ophthalmologist for other treatment options.
But essentially our goal when somebody has dry eye is to increase the amount of tears that are on the surface of the eye. So whether that's supplementing with artificial tear drops, using some sort of anti-inflammatory eye drop, or even oral anti-inflammatory medications, as well as we can put in plugs in the tear ducts so that the tears stick around longer in the eyes. We can do surgery for the eyelids to help with the eyelid position. As well as one other issue that I didn't mention, which is another cause of dry eyes, is actually having poor eyelid hygiene or poor eyelid health. Meaning that if you get a lot of skin cells and debris built up on the eyelids, that can prevent the eyes from making good tears. And so another thing that can be done is good eyelid hygiene, which mainly involves gentle cleaning of the eyelids and sometimes some warm compresses to help increase the quality of the tears.
If you'd like to know more about the causes and treatments for dry eye, contact Dr. Gebhardt at swiconsultants.com. I'm Deborah Uroda for Healthy Living.